I practice emergency medicine, and a few years ago I treated a patient, an 11-year-old girl, a ballerina in fact, who had fallen off of her father's riding mower and lost the front of her foot. I was just devastated at how preventable that was, and I'd wanted to do something about it. And then last May I had an opportunity. Johns Hopkins offers a summer internship program, a diversity internship for students from all over America to come and work on research. And Vanessa Costilla was one of our interns who came from Rice University in Texas. She's a pre-med and she wants to study rural health. And so I put two and two together and said, you know what, rural health, I had this interest in lawnmower injuries. I said, Vanessa, why don't we look at these national data sets on lawnmower injury? We found 80,000 injuries every year in the U.S.
And that's about?
That equals about 2 out of every 1,000 injury-related emergency department visits in the country. And of course they're seasonal, and we see this in the spring and summer, much more so than fall, winter. And the number's increasing. It looks as though we're up about 10% over the rate of injuries in the mid-90s. Well, what we found were a lot of seniors getting injured, and we were surprised by that. No one had ever looked at rates of injury in people over 60, and we found that people over 60 were having the highest rates of emergency room visits for lawnmower problems. We tend to focus on children being injured because, in a sense, there's no excuse for this. A children under 5 has no business in the same yard as a running lawnmower, and that's completely unacceptable. But a senior, they've got a lawn, they've got to mow it, and we just find that they're more likely to be injured than people who are younger. For older people, people over 15, the most common problem, even up until the age 60, was just pain or overstrain, feeling bad after using the lawnmower. That was the number one reason they came into the emergency room after using the lawnmower. They felt bad, pain in their back, pain in their joints, chest pain, dehydration coming after mowing the lawn. For children under 15, that wasn't the problem. For children, it was getting hit by a projectile, some rock or stick shooting out of the lawnmower was the number one problem for the children under 15. Children were also more likely to touch the hot part of the lawnmower. They didn't realize it was hot, and they were likely to get burned. Of the things we would suggest, the number one thing that people are not doing is wearing goggles and wearing gloves when they're using the lawnmower because of these projectiles coming out from under the lawnmower. And then the other thing is just keep your children out of the yard while you're mowing the lawn. Anybody under 15 does not belong in the yard if they're not there to mow it. There's just no reason they can't play indoors or go someplace else while one is mowing the lawn. We also just would echo what the American Academy of Pediatrics already suggests, which is that we just don't let kids mow the lawn until, for push mowers, they've reached age 12, and for riding mowers, I think a child needs to be at least 14 years old in order to be on a riding mower.